Hello, I'm Jane Hayworth. I'm the coordinator of the Population Health major, and I'm located in the School of Population Health within the Faculty of Medicine, Dentistry and Health Sciences. Before I talk about the Population Health major, I just wanted to highlight the majors that are offered through our faculty. That's Aboriginal Health and Wellbeing, Pathology and Laboratory Medicine, Pharmacology, Population Health, and also biomedical science. Biomedical science is a double major and it's offered by the faculties of life and physical sciences with the Faculty of Medicine, Dentistry and Health Sciences. I'm sure that many of you know this, but just to remind you that if you take any of the majors listed on the previous slide within the Bachelor of Science, you will also need to take the complementary units for that major. If you take a major as your second major, you're not required to do the complementary units. But let me now talk about population health. What is it? Many of you may be asking the question, what's it all about? Well, it's really what we do at a societal level to prevent ill health and to promote good health. I see it as 3 Ps, about protecting people from hazards in the environment or occupational setting, promoting good health through promoting environments that encourage people to eat well, exercise, sleep well, etc. And then preventing ill health. So when we determine what the risk factors are for disease, how can we reduce people's exposure to those factors? And how can, at a population level, how can we reduce the incidence of disease? So we've seen some major successes over the last century. We've seen infectious diseases go from very, very high levels of being the major causes of death to predominantly being quite rare diseases. And that's really been about thinking about the way we can prevent exposure to infectious agents through our water, food or air, etc. So, and more recently, we've seen reductions in cardiovascular disease that's been related to a reduction in smoking to very low levels across the community. It hasn't happened quickly. It certainly happened over a period of 30 years or so, but we've seen over that time incremental improvements in the levels of disease in the community. So population health is what we do at a community level to promote health and prevent ill health. You may want to have a look at this YouTube that's on this slide to hear some students' experiences in studying public health, which is really the same as population health. Population health is probably just a more modern name. So population health plays an important role in protecting people's health and well-being and improving the conditions and behaviours in which we live and that affect our health. It's a very exciting area to be in. You can see changes within that result from your work, and plus there's such a broad range of options through working in health policy, through working in health promotion or health research or health administration, so working in the hospital setting. Because whilst we are interested in obviously preventing ill health, we're also interested in, for those people who do have ill health, allowing them access to good health care and access to services that will improve their quality of life. So for people who are ill, what can we do to make sure that they can live to their optimum given their ill health, or we can minimise, what can we do to minimise the impact of their ill health on their quality of life? We're interested in what happens locally, but we're also very much interested in issues of international health, and you'll see that we study issues of health and globalisation within the population health major. So from my perspective, it's been a very exciting career to work in population health, and there's been a lot of diversity where I've worked on things like lead exposure in the community, to road injury, to working in cancer research, to working in water quality research in developing countries. So they've given me a breadth of experience over the time that I've been working in population health. So what do you learn in the population health major? Well, at the level one, what we are doing is introducing you to what are the main health issues, both within Australia and globally. And so you undertake 2 introductory units in year one. In second year, we delve a bit more deeply into how do we know what the risk factors for disease are? How do we know whether a health intervention improves the conditions or the health condition within the community? And what can we do to prevent health? So, is screening effective in reducing or detecting disease earlier and therefore reducing the mortality or deaths that result from that disease by early detection? So, we're interested in a whole range of ways of preventing disease, and whether that be through legislation, through policy, through promoting healthier lifestyles, through screening, through access to healthcare, through improving the environment so people aren't exposed to hazards. That's what we're predominantly focused upon in second year. Obviously, one of the major health issues in Australia is Aboriginal health, because there is such a large disparity between the health of Aboriginal and non-Aboriginal people. So that's one of our key complementary units that you would take as part of the population health major. Communication and project planning are also essential tools when you're working in health, particularly if you want to communicate about risk factors, particularly if you need to plan a program of intervention or health promotion. You need to have good project planning skills to make sure you've thought about the timeline, some of the hazards along the way, etc. In the third year of the program, we will look at how you promote health through the environment, through health systems, and also through research. So then we're getting into the more specialised areas of leadership, health promotion. How does our health system work? It's very complex, but we would like to enable you to be leaders within our health system. So it's important that we consider this and also think about how do you actually go about undertaking a well-planned and well-designed study in health. So in what ways can you study population health? You can study it as a single major in the Bachelor of Science degree. You can study it with another major from science, and population health could either be your primary or secondary major. It could be your primary major, but you then select another major from arts, design, or commerce. And there's some ones that go very nicely with population health, and I'd be happy to answer any questions about that. For example, economics goes very well with health. As a second major, you could do population health as a second major with your primary major in Bachelor of Arts, Design, or Commerce. So you might be interested in anthropology and doing that in a Bachelor of Arts, or population health will enable you to focus upon health anthropology. So how can you study population health? Well, here's a course study plan where you're simply doing a population health major, and your other units are made up of broadening units, complementary units, and electives. So firstly, the population health major, there are 2 units at level 1, 2 units in year 2, and then your 4 units at level 3. You also will need to do the complementary units of Aboriginal health and communication and project planning in health. You'll have the opportunity to do, what have we got there, 4, 6, 10 electives within this course study plan. So, and you can pick those electives from across the university, from any of the science units, any of the arts, commerce, or design units. You'll also do 4 broadening units, and one of those needs to be a Category A broadening units. They need to come from units outside of the Bachelor of Science. So let's look at an example of first year study plan with exercise and health as a second major. These 2 majors go very well together, particularly if you want to work in health promotion and specifically in health promotion related to physical activity, which has so many benefits for health. So physical inactivity is one of the major risk factors for cancer, coronary heart disease, diabetes, etc. So this is a nice combination. But the combination that we show here will also allow you to do anatomy and human biology as a major, even French and physiology as a major. So this particular choice would leave you open to 5 different majors to select from in second year. So these are the core units for the population health major. These are the core units for the exercise and science, exercise and health major, and they could be core units for that as a second major or a primary major, or they could be elective units. These are the elective or core units for anatomy and human biology, and lastly for French, which could be your broadening units. Here's a first year study plan with economics. There is a shortage of health economists in Australia and internationally, and so there are some very good job opportunities there. So if you were to pick this particular combination, you would pick the core units for the population health major. You'd also pick core units for the second major, and then the other units could be made up of 4 broadening units or 2 broadening units and 2 electives, but the broadening units would just need to be outside of the Bachelor of Science. If you pick economics as your core major, well then your broadening units will need to be outside of the Bachelor of Commerce. Here's a study plan with population health with second majors from Aboriginal health and wellbeing, anthropology and Indigenous knowledge, history and heritage. We can see again the core units for the population health major, for Aboriginal health and wellbeing, also for psychology. These psychology units are actually elective units, and then we have anthropology units. So I mentioned before there's a very broad range of employment opportunities from population health. They probably fall into 6 key areas: research and training, planning and management, maintaining standards, improving health, so in particular health promotion, and ensuring people's safety. So if you want to work in disaster preparedness, so for example, there's a section within the Department of Health that is focused predominantly, totally on disaster preparedness. So we'll go and assist when, for example, there were floods in Queensland or the tsunami in Asia, etc. And are also preparing for disasters that may well occur in UWA, not UWA, but in Western Australia, for example, through bushfires, which is a threat each summer. Also thinking about issues of screening, about protecting people from environmental hazards. In terms of working with information, we don't know whether things work unless we have the data to assess that. So information is very important within population health. So there are many occupations that the population health major will lead you to, predominantly obviously in the health sector, but in the public, the private sector, and also non-government organisations such as the Cancer Councils, the National Heart Foundations, Diabetes Association, etc. It's also a useful major to prepare you for further graduate studies in dentistry, medicine, or podiatric medicine or nursing. So in any of the health-related postgraduate courses, this major would be an asset to you. Now, what about broadening units? If you're not taking a science major as your degree-specific major, and the next 2 slides present a list of units that can be taken as Category A broadening units. And these Our ones from the Faculty of Medicine, Dentistry and Health Science, we offer 5 Category A broadening units, and of course all of our other units could be taken as Category B broadening units if you weren't doing a Bachelor of Science major as your primary major. And these are the Category A broadening units from the other science faculties, and you can see that there's a broad range of very interesting topics, and you can read about any of these on the handbook, which is available online or in the libraries. So thank you for listening. I'm happy for you to get in contact with me if you have any questions. My email address is Jane, Jane, Hayworth, HEYWORTH, @uwa.edu.au. And this is finally is a photograph of some population health students on a field trip to India, where they were working on some water quality issues in the Karnataka state of India. And we usually offer this elective every 2 years. Thank you.